Good evening. I wrote this book, Privatisation, Killing the NHS, a few years ago because I was immensely worried about the way government since Margaret Thatcher, and that includes Tony Blair's Labour government, have been pushing a programme of NHS privatisation. I was forced to self-publish it myself, although there are some, because I couldn't find a publisher, although there are also some excellent published books against this privatisation. And I've decided now to read it out online as a way of getting the message across further. Now, the blurb for my book said, "The National Health Service is Britain's greatest institution. Founded in 1948 to provide to the British people with healthcare that is universal and free at the point of use, it has cured and cared for the sick for nearly 70 years. Now it is in the gravest danger. Right-wing politicians from Margaret Thatcher onwards, including John Major, Tony Blair, and recently David Cameron and his health ministers Andrew Lansley and Jeremy Hunt, have carried out a campaign of gradual privatisation. The goal has been to sell out the health service and replace it with a system of private health care, financed through private insurance. Britain's NHS was efficient and cost-effective before these reforms. It does not need them. And if completed, Britain will return to poor health care and conditions of chronic disease and deprivation seen before the NHS's foundation. This pamphlet describes not only how politicians from all parties have conspired to destroy the NHS, but also shows how people, medical professionals and politicos have been complaining against that plan. For the sake of the NHS and the health of the British people itself, we have to stop the Conservatives' privatisation before it is too late." I wrote this when the Conservatives were very definitely in power, but I would add now that we have to be very, very careful about Keir Starmer, because I don't believe Starmer will fight for the NHS. I'd love to be proven wrong, but now, the NHS, founding principles. The NHS was born on the appointed day, July the 5th, 1948. It was set up by the great Labour leader and mine worker in Bevan, and based on the celebrated 1942 report of Sir William Beveridge. The founding principles of the new health service were that it should be publicly funded, universal and free for everyone. Beveridge stated that restoration of a sick person to health is a duty of the state, ... prior to any other. A coalition government white paper of 1944 went on to describe the full scope of the new health service. The new service is designed to provide for everyone who wishes to use it a full range of healthcare. No one will be compelled to use it. Those who prefer to make their own arrangements for medical attention must be free to do so. But to all who use the service, it must offer, as and when required, the care of a family doctor, the skill of a consultant of laboratory services, treatment in hospital, the advice and treatment available in specialised clinics, in brackets, maternity and child welfare centres, tuberculosis dispensaries and the like, dental and ophthalmic treatment, drugs and surgical appliances, midwifery, home nursing and all the other services essential to health. Moreover, all these branches of medical care must be so planned and related to one another that anyone who uses the new service is assured of ready access to whichever of its branches he or she needs. The new health service in all its branches will be free to all, apart from possible charges where certain appliances are provided. Bevan fully agreed. In his 1952 book, In Place of Fear, he wrote, "The collective principle asserts that the resources of medical skill and the apparatus of healing shall be placed at the disposal of the patient without charge when he or she needs them. That medical treatment and care should be a communal responsibility. That they should be made available to rich and poor alike in accordance with medical need and by no other criteria. It claims the financial anxiety in time of sickness is a serious hindrance to recovery, apart from its unnecessary cruelty. It insists that no society can legitimately call itself civilized if a sick person is denied medical aid because of lack of means. And he added, society becomes more wholesome, more serene and spiritually healthier if it knows that its citizens have at the back of their consciousness the knowledge that not only themselves but all their fellows have access, when ill, to the best that medical skill can provide. But private charity and endowment, although inescapably essential at one time, cannot meet the cost of all this. If the job is to be done, the state must accept financial responsibility. Healthcare before the NHS. The new health service replaced a system of mixed public and private provision. They left millions without adequate health care. Lloyd George had introduced compulsory national insurance for sickness and unemployment in 1911. This enrolled the qualifying workers on a panel of doctors, from which they received free medical treatment. They also received a sickness benefit of between 5 and 10 shillings for men and 3 to 7 shillings and 6pence for women. This ran for 26 weeks. If the person was still ill, it was followed by a disablement benefit of 5 shillings a week. By the 1930s, 20 million workers were insured. In 1925, the Act was extended to cover widows, orphans and people over 65. Millions were not covered, as the Act covered only the working husband, not wives and children. These people had to turn to their own savings, private health insurance, or the municipal and voluntary hospitals for their health care. The health insurance and panel doctors schemes were administered through approved societies, which included friendly societies and insurance companies. By 1939, it was recognised that these societies were in fact preventing further extension of needed health care. They gave their members no choice in how they were administered, and some merely existed just to promote their own burial schemes. They did not generally include hospital care. The influence of the insurance companies was so great that in the 1930s their spokesman, Kingsley Wood, actually became a Minister of Health. A 1943 tract by the Fabian Society criticised the failings of the insurance schemes, stating, "The sick are considered not as citizens but as insured persons. The drive for them to recover comes not from the state, which has a vital need, economic, social, political, for national health, but from the approved societies which want to cut the cost of sickness. The whole system is based on an arbitrary distinction between the insured and non-insured. For the latter, unless they are destitute, we provide no general medical service and no maintenance during sickness. The scheme, which was remarkably progressive 30 years ago, has not moved forward with the times and now is obsolete. Health insurance has served its turn." Doctors were not state employees and charged fees. These were often so high that they were unaffordable for many working people. The doctor and medical writer, D. Stark Murray, acknowledged this in his 1942 The Future of Medicine. Whatever relations the doctor has established between himself and his patients, generally with the public in the area in which he lives and works, the greatest barrier to perfect human relations is that sooner or later the question of fees will arise. Medicine remains a service that is sold by the doctor and must be purchased by the patient, since the doctor operates in a competitive system. To earn his living and to pay the cost of his practice, he is bound to make a charge every time his services are utilised. For the patient, this is a great drawback, which in some cases amounts to an insurmountable difficulty. For the more ill he is, the more medical care he will require and, theoretically at least, the more he will be called upon to pay. Where sickness means complete loss of income, the illness becomes not merely something that jeopardizes life, but part of that nightmare which is the loss of those whose economic stability is balanced precariously. Two women described their experiences of the lack of affordable health care before the NHS. Just a minute, please. Bills from general practitioners were always hard to meet. Kay remembered especially a doctor in the Crooksmoor district of Sheffield who employed a debt collector. The effects were particularly severe for working class women who, due to a policy of not employing married women in Sheffield, always tended to fall outside the insurance scheme. Mother never had the doctor. You just didn't go to the doctor until you were on your last legs. Kay recalled how her own mother hadn't gone to the doctor even though she was in bed with asthma. And Jessie likewise, how her mother continued to suffer with high blood pressure, even though she knew that tablets were available which could have helped to lessen her condition. Many doctors therefore refused to set up practice in working class areas, whose people may therefore have been unable to afford their bills. Some doctors, such as Dr. Arnold Elliott, recalled the often low standards of healthcare offered by doctors before the NHS. I ran my practice from a small house in Ilford, but most surgeries were lock-up shops in industrial areas. On the whole, most of them were awful, with no running water, heat, lighting or toilets, some with no couches. I knew one East End doctor who had a cigarette machine in his waiting room. Many doctors had two doors, one for the panel patients, the insured workers, and one for private patients who weren't kept waiting. Doctors didn't speak to each other because they were deadly enemies. They went in for headhunting the breadwinning panel patient who would often bring in the rest of his family. Various private arrangements were set up for his dependents, so-called clubs, where they paid a small amount a week for a doctor and medicine. For the destitute, there were dispensaries which engaged the services of a doctor for a small annual payment. Doctors used to dispense their own medicines too. The pharmaceutical firms came round and filled up the big Winchester bottles every week. Many of the medicines were placebos. Aspirin, for instance, which was available in red or yellow mixture. You had to give the same colour to a patient every week, and sometimes there'd be trouble when you had a locum in and he gave out the wrong one. It sounds immoral, but that was tried. As a result of the poor care offered by the doctors, an increasing number of people were seeking medical help from the hospitals. By 1942, about 2 million people had turned to the hospital outpatients departments. Murray stated clearly that this represented a tacit criticism of the failure of the mixed system of public and private health provision. And I am very, very much afraid that this is the state we are returning to.